Great. Welcome, everybody, to our first Heroin Task Force Community Partners meeting of 2024. My name is Terry Phillips, and I am the facilitator consultant working with the team and the coalition over the past couple of years. We're really excited to have you here today. A lot of new faces, and so I'm really excited to see some new folks. We have a very heavy agenda. There's a lot going on, so we're going to kind of get to it. I want to thank and recognize my dear friend and colleague, Rachel Moore Baird, who is from Nashville and has been tech supporting for us for the last couple of years. So thank you, Rachel, for being here today. So I'm going to go ahead and just start the slideshow and get us going. And again, we are recording so we can put it out on the website. All right. Here we go. So welcome everybody to our quarterly meeting. We have 4 of these a year, and this one is virtual, and our next one will be in person. We'll talk about that in a minute. I want to turn it over to Larry, who's going to welcome us officially.
Thank you, Terry. It is my honor to be co-chair of the Heroin Task Force with Mary Simon, the executive director of Elevate, who you'll be hearing at the end of the meeting. I am super impressed that we have 41 people on a March day when my watch says it's 66 degrees. So I'm sure there was a temptation for some people to say, do I want to go to a virtual meeting or do I want to go for a walk outside? So we really appreciate your being here. We've got a jam-packed, wonderful agenda, and I believe we will be having some small group discussions because we want to hear directly from you, but I especially want to welcome any new community partners who are attending today. We really appreciate your participation, and Terry will be talking about, I think we're gonna try to have our first in-person meeting since probably 4 or 5 years ago.
2020, yeah.
Okay, that would be 4 years ago, and we would really like to see more than everyone's had. So I hope people will get that on their calendars and put down where we're meeting, because it's kind of an experiment to see, will we continue to, we've averaged around 35, 40, 45, 50 people, which we're very happy with. We're hoping the in-person meeting will keep that up. And if it goes well, I think we're looking to do another in-person meeting in the fall. We're definitely going to stick to virtual meetings during the winter, because I don't think we can count on this kind of weather every March. So thank you very much for coming, and I'm going to turn it back to Terry now.
Great, Larry. Thank you so much. We appreciate your leadership. So folks, as Larry was talking about, our June 11th meeting, it is on your calendar. There's even a drive time on your calendar. So for those of you who are new to us, we will merge you with our email list and make sure that you get this on your calendar as well. But we're going to be hosting it at the Waukesha County Business Alliance. They have a wonderful training center room there on the 3rd floor. We'll get you more information about where it is and what the agenda will be as we get closer. But I did want to let you know I'm going to leave like a 30 minutes at the beginning for some networking, because we have to be out at the other end. But I'd like to invite you to come early and maybe meet some of these people that we haven't met, who have been part of our teams for the last few years. So it is on your calendar. And for those of you who are new to us, we'll get it on your calendar.
And Terry, that's on Grandview Boulevard in the same building where the Business Alliance, the Center for Growth, and Community Action Coalition are all in that building, but we'll be giving them the specific address and the floor they need to go to.
Yep, we will. We'll get all that information to them as we get closer. Thanks, Larry. I just wanted to, for those of you who are new to us, a lot of us are using very different platforms. You've got your mute button and your video button, and we'd really love to see your face if your bandwidth allows. The chat, we are always keeping an eye on the chat. Rachel and I will keep an eye on the chat for questions. And we also encourage you to put some reactions. You know, if something is good, go ahead and give it a thumbs up or a clap or what have you. So try to engage if you can in our meeting today. We have some guidelines that we've been using for our virtual meetings, and this is not new, nothing is new, but because we have so many of us in the room, the virtual room, we would love for you to use the hand raise feature, and that's under your reaction button. Keep your mic muted, which we all kind of know this at this point, just to reduce background noises. And just kind of be aware of airtime. There's 43 of us, so we'll just watch for that. So these are just some of the guidelines that we've been using over the last few years. And I just wanted to lay out the goals. They're on your agenda, but we really, again, always want to have an opportunity to network with our partners. I'm also going to invite you, if you would like to hang out after the meeting is over. I'm going to have some what we're calling water cooler time. I can put you in small groups if there's a discussion that needs to be had, or if someone wants to get a little bit deeper in a conversation that we had today, we will hang out a little bit with you. We're also going to introduce the Community Health Improvement Plan to you folks. I'm really excited because I have the opportunity to work with that team as well. And the 3 strategic health issues, healthy aging, mental health, and substance use, surface to the top. And these leaders have come today to share the strategies that they selected. And some of these do intersect with the work that we're doing. So we want to make sure we're not duplicating efforts, but supporting each other and working together. The next thing that we're going to share with you after the CHIP is that there is a grant opportunity for those partners who might be part of the CHIP or part of our substance use action teams here with our Heroin Task Force, or if you're a partner that wants to walk along parallel with some of these strategies, we'll be introducing a potential grant opportunity for you as well. And then we always highlight the work of our action teams, and so we'll be doing that as well. You guys have the agenda, so I'm going to flip through that. And at this point, I'm going to stop sharing and welcome County Executive Paul Farrow. Paul has been a tremendous leader in this world of substance use, and he is going to share a little bit about what the county, give us a little bit of an update of what the county is doing, and we welcome you to the meeting.
Thanks, Terry, and hi, everybody. I hope everybody's enjoying it. Larry, I agree with you. I would rather be outside right now. Taking advantage of the 66-degree weather is kind of nice. The rest of the county employees, I'm glad to see you guys are in your offices. Nicole, it's a little fuzzy back there, but I think that's the office. So I just wanted to jump on real quick and give you an update. The team's going to give you an update on what's going on a day-to-day, but I want to fill you in a little bit of what I've been hearing from other county executives in other counties. In the last 6 months, I've had an opportunity to be at a national conference of county executives, and then was out at the Wisconsin Counties Association about 6 weeks ago for our legislative conference. Talking with individuals, I will tell you right now, I can't be more proud of this group and the organizations we have here in Waukesha County. We are so far ahead of the curve of what people are trying to do when it comes to opioids, the fentanyl issues, mental health, and combining everything to really provide the best level of services we can for the people in our area. I had the opportunity, like I said, I was out in DC or Miami. It wasn't DC this time, for this conference of county executives. And I was talking to individuals across the country who haven't even gotten halfway through what we are doing. And they're saying, we're seeing the epidemic rise. And for me, it was kind of exciting to say, look, we've got these plans. We're having teams deliver these OAK kits out in the community. We're doing training for Narcan. We've embedded mental health individuals into our law enforcement to help. All these things that I almost now I'm taking for granted that everybody else is doing, we're on the forefront. And it's because of the work that this organization does, it's because of the work that you all do on a daily basis to feed us information, get us ideas, work together to create this. And as Terry talked about on Thursday, we're going to kind of step into the next phase of the CHIP program. We're in the middle of a 5-year plan. We're breaking it down and coming a little bit more on metrics and what we can do to get some solid outcomes and see how to work it through. I think the work that we're going to be doing there is going to have lasting effect, not only in just a few areas that we're looking at, but when I look at the residual and what we can do and hopefully replicate it in different areas throughout the county is going to be helpful. So I just wanted to jump on real quick and say thank you all so much for your hard work. Keep up what you're doing. I actually look forward to seeing everybody in person. It's kind of nice to go 3-dimensional and see what's happening out there and have some great conversations in a couple of months. So Terry, I'll take it back to you. Thank you so much.
Great. Thank you so much for being here. We really appreciate it. And yes, it will be nice to meet people, some of the people that we haven't met yet. So I appreciate it. Thanks for being here, Paul. I'm going to share my screen one more time here, and I would like to welcome, I'm doing I'm calling an audible. That's what it is. I was trying to remember what that was called in football. I'm calling an audible. I forgot to put Dr. Saw on our agenda, so I'm calling it audible, and I want to welcome Dr. Leon Saw from UW Milwaukee. I sent an email out back in February at the request of a couple of researchers from UW Milwaukee and the Medical College of Wisconsin. They are doing some research, and they are hoping to reach out to organizations such as you to gather some feedback and be part of the research. So Leanne, I'm going to turn it to you, and we're going to just try this real quick, and if it doesn't work for you, I will be your navigator here. Actually, I can't even find you fast enough. So you go ahead and I will be your navigator. Just tell me to flip to the next slide.
Okay, sounds good. Hi, everyone. My name is Dr. Leon Saw. As Terry mentioned, I'm at UW Milwaukee. I'm in the Department of Criminal Justice and Criminology. I'm representing a group of researchers. We're in the process of kicking off some exciting work and wanted to talk to you all about it. We think there might be some potential overlap here. So we're working on a project where we're trying to learn more about the experiences of youth caregivers who care for a person with opioid use disorder. We're defining youth caregiver as children and youth in that 10 to 18-year-old range. What we'd like to do at this phase in the project is we'd like to work with the community. We'd like to work with people who are actively working on this issue, working with families, working with youth. And we want to establish a community advisory board to discuss potential community and university partnerships, other collaborative opportunities that could potentially include grants and going after different types of opportunities together. Essentially, the research question that we're trying to answer is how opioid use disorder has affected young people and their role as caregivers. If you can go to the next slide, Terry.
You bet.
Thanks. So some of our outcomes that we're hoping to achieve in this project, in the short term, I mentioned we want to establish this community advisory board, and the role of that community advisory board is to help guide and advise, the research process and how we go about conducting our work. There's going to be a strong qualitative component to this work where eventually we are hoping to secure grant funding as I move into the medium-term outcomes to conduct a series of interviews with youth caregivers who are caring for family members with opioid use disorder, interviewing family members with opioid use disorder, and also you folks who are out here working with this population every day. And in the long term, what we'd like to achieve is we hope to develop some interventions and provide some resources on youth caregiving for family members with opioid use disorder. So my ask here today is if you are interested in participating in the Community Advisory Board, or if you know of someone who might be a good fit for the Community Advisory Board, please feel free to contact me. My contact information is on the screen, and we'll also put it in the chat.
Yep, we'll pop it in the chat for you.
Thanks, Terry. And that's it. Thank you for your time. I appreciate it. And it's very, it's very inspiring to hear about all the things that you all have going on. So I'm happy to be here.
Leon, we are really thrilled to have you here and invite you to stay for sure. Rachel's going to drop the information into the chat for us, but if there's anything else we can do to support your work, that would be wonderful. Thank you so much for being here. All right, great. And now I think I'm gonna turn it over to, let me share my screen one more time here. Sorry, forgot where I was for a second. There we go. Can you guys see it okay? All right, quick updates. Mary Simon and Nicole Kelly, I'm going to kind of turn it to you guys because first of all, and I want to continue to thank Elevate for hosting our website for us. It has been fantastic. Mary keeps it updated for us. It's so nice to have a place to put things, but we've got a couple of things that have happened. So Nicole and Mary, I'm going to turn it to you.
I'll let Nicole go.
Sure. So I want to thank Mary for participating in an on-camera interview with CBS 58, which I think Terry linked in your agenda if you want to check that out or you haven't seen it. We had this great document with all the accomplishments of the Heroin Task Force for 2023, and the steering committee thought that's something that we should share with the public. So we wrote up a news release and sent that out, and we got a little bit of coverage from a couple of news stations as well as the Freeman. And I think the main thing that we highlighted in there is Heroin Task Force has been a great way to bring people together. And as a community, we've seen a 19% decrease in the overall overdose deaths from 21 to 22. And I don't think it's in the news release, but the fentanyl related deaths actually went down almost 35%. So I definitely think that's related to the work of everything that this group is doing. So we really wanted to highlight that and share that with the public.
Great, thank you. And please keep checking our website. Please steer people to our website because it is updated, and we want to continue encouraging people to join us in this work. So speaking of people, I am really excited to introduce, and many of you already know, Amanda De Leon from Community Medical Services, CMS. Amanda is a community impact manager, and she has been working with the Heroin Task Force now for the last couple of years, serving as one of our chairs. She's been serving on the steering committee, and we are spotlighting CMS this meeting. And I also want to put a plug for any agency who would like to be the agency spotlight. Please send me an email and we'll get you in on the next agenda. But I'm going to turn it over to Amanda, and she's going to tell us a little bit about what's going on at CMS. And Amanda, I think I'm going to try to give you slide control. If you see it. Yep.
Do I hit it here?
Okay.
Did I do that?
You did it.
I've never done this on Zoom, so I was like, okay, is that a pop-up box from you sharing your screen, or is that mine?
You're all good.
All right, so Terry did a wonderful job at already introducing myself, so I don't need to do that again. But I am from Community Medical Services, and I'm not going to go through this entire slide, and you guys will have all of our slides, the slides that are in this presentation. Terry will attach them to this, what is it, the Google Drive. So this is just a little bit about our mission, vision, and our values. The thing I like to highlight is our vision. We are leading the change to eliminate the consequences of substance use disorder in our communities. And just as Terry said, we like to attach ourselves to any and everything that pertains to opioid use disorders, so we can fight this battle together and reduce the amount of lives that are lost due to the opioid crisis. And so a little bit about who we are, short and sweet on these slides, because I didn't want to give you guys too much information. So our Pewaukee location is located on 1611 Silver Nail Road. That's right over there by the Business Alliance and right below the church there on Silver Nail Road. We are an opioid treatment program on demand. So what that means is that anyone can walk in between the business hours that I have on the next slide, and they can start treatment that day. We don't need to schedule an appointment with them, although we know some people are used to it. So if they still want their appointment scheduled, we'll schedule that for them. However, we will strongly encourage them to come in now and we can start their treatment that day. And what treatment looks like is we provide one-on-one counseling, and then all 3 FDA-approved medications for opioid use disorder. So we offer methadone, buprenorphine, and the Vivitrol products. And here we go, our hours of operation. So we are open 7 days a week. We are regulated by the state DEA and the feds. So that means that we do have to be open every single day, because individuals that do not have complete abstinence do have to come into the program every day to get their medications. The only folks that get to have take-home medications are those that are only testing positive for the substances in which they're prescribed, as well as they're adhering to going to their counseling sessions, going to their medical provider appointments, doing all their lab work, just doing everything that is defined in their treatment plan, right? So for the folks that are still using substances, they do need to come into the clinic every single day to dose. So that's why we're open 7 days a week. I did want to throw a plug in here. We do have an open house every single Tuesday from 12 to 1. That's when you guys will be greeted by Patrick Riley, who's now the clinic manager over at Pewaukee. So him and his team will be there greeting you guys, but they will be there every Tuesday from 12 to 1 if you want to come see what an opioid treatment program looks like. I always say go in and see it, because then you know where you're referring folks to and you get to meet the staff and put faces to a name. We do admissions Monday through Friday only, from 5 a.m. till noon. They will try to do an admission right at noon. We have an amazing team of folks there. You know, the thing that we do is ask them, does anybody have anything that they cannot stay for, right? Like if they're, you know, we always put family first, our own family first. We would never ask anybody to do anything different, right? So if they had to get home to their kids or whatever it may be, we do understand that. But our staff will stay past closing time just to make sure that individual gets the care that they're seeking. Dosing hours, Monday through Friday from 5 a.m. till noon. And then on Saturday and Sunday, they're abbreviated hours from 6 a.m. till 10 a.m. Come on, slide. Okay, so Terry asked for some of the challenges that we face, right? So one of the major challenges is not being able to connect with social workers in the emergency rooms. We know a lot of the mental health inpatient units have been closed down in a lot of hospitals. So we know that the ERs are being inundated now and nowhere to send folks to. So we've always had a challenge connecting with social workers in the emergency room. So that way we can make sure that they get the care that they need. Another challenge is individuals not receiving their medications while they're incarcerated or in residential treatment. That has been one of our biggest barriers for our folks that are on methadone specifically, is not being able to get their medication while incarcerated or in residential treatment due to the barriers with, could be within those organizations, but also within our state rules. And not enough housing resources for our individuals who want to leave their current living environments. People that come out of, let's say, incarceration might not have a place to go back to, or somebody that's in a using environment. They don't want to go back to that using environment, but where are we going to send them to? We would love to welcome everyone into our homes, but yay, let's talk about boundaries here, right? But we want to be able to give these individuals a safe place for them to heal and to guide them on their path of recovery. So there's just some of our challenges. So this was a great story that we had to share, and I love this story. So we have a partnership with the Milwaukee CRC, which used to be the House of Corrections. And what we do is we do in-reach of counseling and peer support to these individuals. The individual that was doing the counseling within that program now was a counselor at the Pewaukee location. So the individual was transferred to Huber at Waukesha. The Waukesha jail allowed him to be in Huber due to being on methadone. So it was just amazing. Like there was a lot of things that needed to happen to make this happen. And then he was able to get out and do his admission at the Pewaukee location, start on his medications at the Pewaukee location. Oh wait, he wasn't on methadone. I apologize. He was on buprenorphine products. But then he was able to go to that clinic, start his medication. And when he walked in, he was able to see a counselor that the same counselor that he worked with within the Behind the Walls program at CRC. So everything came around full circle. He was extremely grateful for the support that he had with the team Behind the Walls, but he was also extremely grateful to see a friendly face in person, right? This was all virtual that they've ever interacted with. And he appreciated that support and having a friendly face when he came into treatment. Because we all know when folks come into treatment, that's a hard step, right? And to see a friendly face just made it better for him. Okay, next slide.
Yep.
So I did too much. Okay,
Yep.
so this is one of the quotes that I love the most by Deputy Chief Suarez Del Rio from the West Dallas Fire Department. And for those who don't know, we do have an opioid treatment program on demand that is extended hours in West Dallas. We used to be 24/7, but then moved our hours from 4 a.m. till 6 p.m. And that's Monday through Sunday. So he had stated that we saw a record drop in fatal and non-fatal overdoses in the city of West Dallas, and that would not be possible without CMS. So when the entire city or the county of Milwaukee was increasing their overdoses, they dropped by 60%. So I'd like to take credit for when credit's due. So that was because we had a treatment center there and their overdose response team was bringing people to us for treatment. And then just a thank you. I don't know why my name is so tiny on there. But because I did proofread these a lot of times.
I copied it over, so it could have been me.
Okay. So there's my information, there's Patrick's information. I will put a plug if there's anything that you want to know about the Pewaukee location, just go ahead and contact Patrick. You can eliminate me so then that way you can get to the source yourself. But again, you guys can walk into the treatment center. We're not entirely busy. We do prefer you to come in after 12 o'clock because staff is still there. But let's say Tuesday doesn't work out for you. Just reach out to Patrick and he'll make sure that he's there for a day that works out for you.
Amanda, thank you so much for being here. Larry, you have your hand up.
I had two quick things. First of all, I wanted to thank Amanda for her service on the steering committee. I have to admit, I did not totally understand what community medical services is and was until I went to their open house. And the clinic is right on Silvernail off of Grandview. And I would encourage anybody who is like me and didn't really know what it is or how it works to find time on a Tuesday to go and visit it, because I think it's another piece of the puzzle that's needed in Waukesha County to be part of our task force efforts to help people. I also want to say I now understand why Amanda was always in her car at our meetings, because she's running all over the place. And we're very happy to welcome Patrick Riley back to the steering committee because he is the new person in charge of the Pewaukee Clinic. So thank you, Amanda. And it's really great that your clinic is here in the county and working and helping people already.
No, thank you. I mean, we love that we have this support and we love that Waukesha County is moving forward, right, in this opioid crisis and trying to figure out solutions and be a part of that solution and action versus a part of the problem. So we love that. And yes, I'm always in my car. But the open house is from 12 to 2. So it's not 12 to 1, it's 12 to 2. So my mistake. I thought I put a 1 there, but it should be 2 p.m. So 2 full hours.
And those in your agenda, and Rachel also threw it into the chat, all of those documents that we had on your agenda, she put in the chat, that gives you all the information you would need. And I echo Larry's sentiments, Amanda. We really loved working with you. We're glad you're staying within the family, if you will. And Patrick, we're thrilled to have you. We know you're online today too. Any questions, any other questions for Amanda?
And just reach out. If you guys need something, just reach out. We can come to your place. That's why I'm always in my car. If you guys want a presentation or need any information, we'd be more than willing to do that.
Thank you. Thank you again. And I'm going to put one more shameless plug in for any agency who wants to be our agency spotlight for June. Please let me know, and we'll get you on that agenda. All right. So we'll take a breath here for a second. So for 30 minutes, we have thrown a lot at you. I appreciate you being flexible for our little pulling an audible there. And I'm so glad that Leon was able to share his information. But now we're going to take about 15-20 minutes to do a little bit of discussing and conversation in networking from a task force. So let me just share my screen again and get us going. So back in December, we did a little bit of networking, and we asked you all to consider what your why is. Why are you engaged in this work? We know this takes a lot. It's not easy work, and we all have different reasons for our engagement. And kind of examining our engagement is always a good, thing to take a look at. So what we did was we asked, what is your why? And then we had you record this, and we took your whys and bucketed them into 5 different buckets. So some of you are here because you want to make a difference. We want to make improve our community. We want to help people. We want to make a difference. Another set of you or group of you have personal experiences. You might have had family members or friends who have struggled with opioid addiction, or you yourself might be struggling and or be in recovery, or have had some other personal experience. So that was a fairly large category as well. The third category is reducing stigma / access to resources. And that was bundled together. Many of you thought or phrased, I don't ever want someone to not know the resources that are available in Waukesha County, or I don't ever want stigma to be the reason why someone is not accessing resources. So that was that bucket. Professional interest. There are many of you here who work in this world. You're probably a little bit of a few of these things. So professional interest. And then there are quite a few people who are here. They're working in the youth children area. So what I'd like you to do at this time is just to kind of take a look at these and just personally take a look at, where do you see yourself in these categories? And it may be more than one category. So just kind of take a second to look at that. So where we want to go from here is we want to marry your personal whys with the mission of the Heroin Task Force. We're always looking for ways to continue to improve our work. So again, our why we're here is really important to us, but we also want to see where that crossover is to the mission of the task force and how we can enhance our efforts. So today in our small group conversation, we're going to just do one breakout. Last time we did 3. This is just going to be a 1 10-minute breakout. And we're going to ask you to talk about this question. How can we enhance our collaborative efforts to better align your personal why with the mission of the Heroin Task Force? What suggestions might you have? So again, as a coalition, we always are looking for ways to improve our work and to improve how we work together. So we're going to spend a little time in a breakout room having this conversation. You can kind of noodle on this while I'm giving some instructions. As I mentioned, they're going to be 10-minute breakout rooms. We do not have facilitators in the breakout rooms, so you're going to have to self-organize. There are, 44 of us. We're going to have 8 breakout rooms, so there'll be 5 to 6 folks in a breakout room. Quickly introduce yourself and your organization. And what we're going to have you do is talk about this question. Now, I am going to use a product called Padlet today. We're going to try something new today. And if the technology gets in the way of the conversation, I want you to let the technology go. The conversation is most important, and you can always type your responses into the chat. but I'm going to share with you what this looks like. You will, Rachel is going to drop a link into the chat, and you can either access this question on Padlet from your computer, or I'm going to give you a QR code and you can access it on your phone. The way this works, each breakout group, when you get into Zoom, look in the upper left-hand corner and you'll see your breakout number. So if I have been put into breakout room 3, this is where I'm going to be typing my answers. And all you do is click the plus. You can put a subject line if you want. I'm just going to put subject header. You don't have to, but you can write your great idea and just hit publish, and it gets put into the Padlet. You can edit it or you can delete it if you're not happy with it. You can put them in as a group or you can put them in individually. And if you're on your phone, you have to just scroll across to get to your breakout room. And again, I don't want technology to get in the way of the conversation, but I just thought this might be fun. And I'm always trying to share new technology with you because then you can make your own virtual meetings more fun. So I'm going to stop for a second and let me get back to the slide deck here. And I am going to, Rachel, yep, let's throw in into the chat. You have 2 choices. You can either get this link that she is popping in the chat and you can get it on your computer, or you can lift up your phone and access it via your phone. If you only have one screen, the phone is a great option. And for those of you who don't feel comfortable doing this, I'm sure there's someone in your room who could help put your idea in. Any questions about what we're doing for the next 10 minutes? I'm looking for raised hands here. All right, Rachel, are we ready to go into our breakout rooms? Okay, great. Does everyone have, I don't want to stop sharing yet. Does everybody have access to the, who wants access? Okay. All right, let me stop sharing for a second. All right, friends, enjoy your time in your breakout room. Forgot to start the recording. We're back from our breakout rooms. So no one wants to share their conversation, just kind of the gist of the conversation?
Haley or Bill, why don't you share the wonderful comments you shared in our small group?
Larry, what room were you? Do you remember?
I don't know what room we were in.
Okay.
Room 7.
Got it. I'm going to bring up your thing so people can see it. All right, Bill, I'm calling on you. Uh-oh. No, Bill. Who was the other person, Larry?
Haley.
It was me, Terry.
Haley. Okay, Haley.
Sure. We just had a conversation about, Larry put it really well, about conscious expansion and making sure that we have the right people at the table, but that we continue to grow that table as well so that we can foster collaboration and make sure that we're using this meeting and this group to make the right connections so that we can all move forward together. And then we did add in there, I added in there that I think part of the reason that this group is so successful is because we have the support of our elected officials. Other counties don't have that. And I think that is really important to the success and the forward momentum that this group continues to see.
Haley, thank you so much. Patrick and then Mary Bear.
Just going off of what was just said, a couple things we talked about. One was getting the right people at the table, and the knowledge experts are not at the table, and I'm referencing people that use drugs. It is quite common in meetings like this where we have a large group of people deciding what is best for a specific population, and that specific population is not involved in the conversation. And then the other one was just challenging Everyone's challenging the idea of opinions versus facts. So I'll use myself, for example. At one point, my understanding was total abstinence is the gold standard, and anything less than that is a failure. Versus, evidence-based practices, peer-reviewed articles, things like that. We're using actual science and data versus personal opinions on what recovery looks like.
Patrick, thank you. Great points. Thanks so much. And Mary, we'll let you have the final word.
Okay. We had a really great discussion, and we were blessed that Stephanie Engel, the embedded social worker. Can you hear me?
Yes, we sure can.
Myself, and I am unmuted. So anyhow, and we had Stephanie Engel as part of our group, who talked about the 60 people that are now part of this whole group that is supporting, from why did you start to what, to the analysis of with the medical examiner of why and how people use drugs and what can we do to prevent that. And just a great group of people, and we all feel two things. We'd like to have more publicity, success stories. What have you heard? Whose life has you can do it anonymously, but there's between social media and the paper and just sharing stories, even on the task force of successes, really gives people a reason for why they're doing this and what it means to the people that are being served by all of you that are doing this fabulous work. And then and she also mentioned that there's 45 or 50 people on this call, and we meet quarterly and we get all excited and things like that. But Stephanie would like to have the ability to connect with somebody she may have talked to or heard from or things like that. And again, so that we can establish more than just once or 4 times a year, that we would have more relationships. Okay, so that was what came out of our group.
Mary, that's great. And Stephanie, I would really appreciate your input. It's actually a great segue to you at this point. We'll take this information and noodle it with the steering committee and see if we can put some action around some of the ideas that you came up with. I'm so grateful. This is how coalitions continue to get better, is by questioning what we can do. So thank you guys for taking the time to do that.
Terry,
yeah.
I just want to put out there for anybody at this meeting who is not currently on one of the 4 action teams, that is the way, if you have time, to get more involved in the task force. And I hope for most people, if you're on an action team, it ends up being a win-win involvement, because I think for most people on these action teams, what they're focusing on dovetails with their day job. So maybe, Terry, part of the recap can be a link to the action teams and how people can join them, because early in the calendar year would be a great time to join them. Most of them meet monthly.
Yep.
And action teams understand if you can't make every meeting, but make when you can. That's another great way to take your involvement up to another level.
Absolutely. Larry, thank you. Thanks so much. I actually think this is a great time, Stephanie Engel, to introduce you. I know we don't have any slides, so we're just going to introduce you. Stephanie has been working incredibly hard. We brought her in last year, I think, a couple times last year, to talk about the overdose fatality review process. Stephanie, I'm just going to turn it to you and let you give us a little high level of what's going on, how things are progressing, and we'll go from there.
Thank you, Terry. I'm really excited to be here. This group is filled with energy and motivation, so it's always energizing to come into this space. So I'm going to just provide a really high level overview, pretty specific to our first quarter of progress with the overdose fatality review. So we publicly launched our Waukesha County Overdose Fatality Review in partnership with ProHealth, who generously hosted our team on January 18th. We did have a turnout of 60 members. And moving forward, that was our orientation back in January. And we are going to be having 5 we'll be meeting bi-monthly, and so we will have our first review of an actual fatality this month. And right now on that team, we have 23 members represented across 15 different agencies. Huge shout out to this team for really pulling in some of those members. They're represented from a wide variety of professional sectors, from the medical examiner's office to treatment providers to law enforcement and more, people with lived experience. And at this point, we are attempting to retain as many people as we started with for our orientation. And so we are hoping to do that. There is a lot of legality that's involved in an overdose fatality review. So we're working to get ourselves through that, which is a fairly difficult and strenuous process, but we're getting there. And let me see, moving on here, I have a couple bullet points. So really the purpose of our overdose fatality review is for that team to come together to review a sample of cases to identify risk factors, protective factors, trends, and really have this professional team look at where are the systems gaps, where are the missed opportunities. And then that team will come together to author recommendations with really the central focus being on the prevention of future fatal and non-fatal substance-related deaths. And so that's really our focus, is to make sure that we are doing what we can to reduce and prevent substance-related deaths in this county. The recommendations that are put forth by our core OFR team will then be shared with a steering committee, which is made up of 13 members representing 9 different agencies, and that steering committee will further review, discuss, and prioritize those recommendations. Overall, I think this is a really exciting time for our county to be doing something that is based on a national review model that is really put forth and embedded in research and science. And I'm excited to see how our region and how our team will shift the trajectory in this county in the coming months and years. Hopefully with the intention of supporting and responding to individuals and families within our community who are in the throes of substance use and experiencing loss. That's my update, and I'm open to any questions you have.
Thanks so much. I know many of you are involved in this. So any questions for Stephanie at this point? You're doing a fantastic job, and thank you for all
I would
of your
just
efforts.
comment, Terry, Terry?
Yep.
I just wanted to say what an important step this is, because it's one thing to have anecdotal evidence about what's going on. And as an elected official, it's very helpful to have hard data to show what's going on, what's up, what's down, where things are. So I just wanted to thank Stephanie and everybody involved in the overdose fatality review, because I know it was a lot of work to get it off the ground again. But I think it's another key part of the puzzle that's going to help us make more progress on this, because a year from now, we'll have more information. We'll be able to understand, hopefully better, what's working, what's not working, and how do we need to evolve to address, because if there's one thing that I've learned, these issues evolve, the drugs evolve, and we as a task force have to evolve along with it. So I see this overdose fatality review as another key component to allow us to do that. So Stephanie and whoever else is involved, thank you very much.
Fantastic, thank you. Folks, I'm going to give you a 3-minute break. Just give yourself a chance to stretch, step away from the computer for a minute, grab something to drink, and then please turn your camera back on so I know you're back. But this is a little timer that will help you kind of keep track of when we'll start back up. I know you're here. Thank you so much, Rachel, for turning our recording back on. Wonderful. The next half of our meeting, we're going to start with our metrics and measurements team, and then we're going to head right into our chip. Let me share my screen, and Francis, I'm going to turn it right to you.
Sure. So I just wanted to give a quick update with my co-chair Felicia on the metrics and measurements team. You can advance.
Yeah, I was looking for your name. I was going to give you the controls.
In December, we took the data literacy quiz and we all found out what our data persona is. So today I just want to go through the results and get your guys' feedback on next steps. You can advance. So to the data team's surprise and delight, out of the 47 respondents, 53% ranked as an apprentice, 13% ranked as a novice, and 34% ranked as a guru. Our goal was to get 75% of people at the apprentice level or above, and we have already reached that goal. So we needed to sort of rethink how we want to approach this because we actually have a more data literate team than we anticipated. So we actually can move a little quicker and do some more cool things. And something that was really encouraging is that we have no data avoiders in our group. So everyone here is at minimum interested in data and wanting to know more. Just some things that we learned from our quiz. 58% of respondents said that they use data all the time, but only 16% of respondents said that they have access to all the data that they need. So even going back to Terry's activity earlier, data sharing and getting access to good data is really important and something that we hope Heroin Task Force can work on. And then of the respondents, 48% of people said that they prefer practical applications to learn. So that's going to come in to play a little bit later in my spiel of how we actually do that. You can advance. So from the survey, we learned a little bit about each group, and this is going to help drive our learning priorities for the Heroin Task Force. For people that ranked in the data guru category, they were really interested in creating data visualization. So we can think about how we can assist that group in making data visualizations, both in formal dashboards and in things like PowerPoints and papers. This group was also interested in knowing more about advanced statistics and predictive analytics. The data apprentice group, some people seem to want a little bit of a review of some fundamental statistical methods. So things like knowing exactly what an outlier is, what central tendency is, what causation means. This group sort of understood, but certainly seemed like maybe they could use a once over to really fully feel confident. And this group wanted to understand data visualization. So when I look at a dashboard, what am I seeing and how do I feel confident in interpreting what I see to make decisions? And last but certainly not least, data novices, people who are new to data, really wanted more experience just exploring and getting into data. Where do I go when I want to find out some more information about a topic I'm interested in? How do I find trusted sources? And then how do I use that data in my daily work? And then this group also seemed maybe we could introduce some fundamental statistics to them. So more so, a little less than the data apprentice who might already know these concepts. Data novice seemed interested in starting to think of how would I find central tendency? Why would that be important? So this will help drive how we introduce new topics to you moving forward. And you can move to the next. We did create a dashboard with this data, which will help us show you the data, but will also give you experience to like play around with the dashboard. We're currently looking for ways to make this publicly viewable to you. So maybe an opportunity to coordinate with Elevate to get it on our website, because right now it's housed in our Waukesha County's like employee only website. So know that that's coming. Bill King made a really beautiful dashboard that we can help, that we can show and then give people more dashboarding experience too. So looking for that in June of 2024 to show you
Awesome.
guys.
Dashboarding's fun.
And then the question that we have for you guys, Terry's gonna launch a poll, but we started to think, how do we teach these? How do we really give people more experience with data? Of course, we have a couple minutes each quarterly meeting, but to really teach you something, 5 to 10 minutes once a quarter really isn't enough. And so our group started to think of what other things could we do that the group might be interested in, and we came up with some ideas. So one would be maybe an hour before our meeting, or maybe bi-monthly, we have some sort of data lab where we meet together in synchronicity, and we work through something. So maybe it's, I'll give you a data set and you find central tendency. Maybe it's let's look at this dashboard together. Maybe it's let's create data viz together. So the benefit of this is that you would have me, Bill, Felicia, Nicole, etc. to learn from. The con would be you would have to meet us at a certain time. We could do a version of that asynchronously, where we do some sort of webinar. The pro obviously being you can do that on your time. The con being maybe we're not there to answer questions in real time. And then our last option would be some sort of written resource where we sort of provide maybe an article. We show you what we see in it and give you kind of a chance to learn as you go and as you are. All three of these things could be solutions to help improve some data literacy of our group, but we didn't want to move forward without getting some buy-in from what this group actually wants and needs. So Terry, if you have the poll, I would love to get some feedback. And you can click one, you could click none, one, or all three.
I think you can. I think you can click one, none, or all three. So I think that's how I set it up.
Sure. While people are voting, Felicia, did I miss anything that you want the group to know? I know we have a lot to get through, so I talked pretty quick.
No, I think you got it all. We just want to share appreciation and thank you for everyone that did complete our survey. We really do appreciate that. And as data people, we really love to make decisions with data-driven decision making. So thank you.
Yeah, we got 47 respondents, which is amazing. That was a great number.
That is amazing. Absolutely. All right. Are we pretty good, everybody? Like, can I end the poll? Thumbs up. You've done it. Okay. And here are the results, you guys. Oops. Can you see them?
Yes. So it looks like some of those asynchronous webinars might win out. So our group will take that.
By the synchronous data lab.
Yes. Yeah, seems like all three of those resources would be appreciated. So
I'll get this data to you.
Great, wonderful.
Fantastic. Felicia, Francis, data team, thank you so much. Did I stop sharing those results? Yeah. Okay, good. All right. We are heading into our community health improvement plan. We have quite a few guests here online to share the community health improvement plan with you. Francis, would you like me to screen share the slide deck?
Sure, if you have it up.
I do. And where would you like me to start? Do you want to give a 2-second, just a minute high level before we hit the teams?
Sure. Start at slide 11.
Got it. All right.
So while Terry's getting that up, hello, welcome back. I'm Francis. I'm now in a different role, and I'm one of the people organizing the Community Health Improvement Plan, the CHIP launch. And so I just want to tee up for you what you're about to hear. You can go to the next slide, Terry.
Francis, I just gave you control.
Oh, you gave me, got it.
Yep, got it, perfect.
So the Community Health Improvement Plan, the CHIP, is a 5-year process. We are currently in year 3, 2024. We've gone through assessment and planning with our steering committee, strategy development with the creation of our action teams, which you'll hear from in just a second. Now we're going into implementation where they take all of that information, all of that community work, and all of that data and come up with a plan to put it in the community. In 2025, we'll continue to implement, monitor, and evaluate. And in 2026, reporting, refining, taking what worked and trying to find sustainability, and taking what didn't work and going into our next cycle to better the health outcomes of our community. In the interest of time, I'm going to skip over explaining our values, but these are our 12 values of our CHIP process. If you're interested in seeing how we got the data for this process, that's available in our community health assessment that was completed in 2022. You can find that document on our CHIP website. And once I'm done presenting, I'll also pop it in the chat for you as well.
I got it for you.
Amazing. We use a process called results-based accountability, which is a framework that helps us improve health outcomes by measuring our results. And so you'll see that our action teams are set up in a very specific way to follow this results-based accountability model to really provide transparency and framework and tact to how we pick what we picked and why. And last but not least, we also have a dashboard, which you can see all of our progress and track along with us these next 3 years. Some things I like for you to note is that this is an interactive dashboard. So you will see things change in the next 3 years. This is our most up-to-date copy. It's a working, living, breathing document that we hope you find insightful into our process. If you go to this website and you'll click, you'll see some arrows. The arrows will tell you if up is good or up is bad, if down is good or down is bad. So generally, green means our data is trending in the right direction, and red means our data is trending in the wrong direction. If you go to this website, you can click and play around with, which I encourage everyone to do after hearing this presentation. And I also hope you find that this really gives accountability and transparency to our process, which is something that really means a lot to us and is in our values for the CHIP process. So I know that was fast.
Yep. And Larry, I see that your hand is raised. I'm wondering if you wouldn't mind holding the question unless it's something that because I want to make sure we get through the action teams, if that's okay.
Sure.
Thank you so much.
I know that was fast. I only had a couple minutes to do that. But without further ado, I am pleased to introduce our 3 action teams: healthy aging, mental health, and substance use. We're going to briefly walk you through what work they've been doing, how they got to the end results, data indicators, and strategies they selected, and a high-level overview of what their team plans to do in the next 3 years. So I'll pass it off to our healthy aging team, led by Sarah Boots, Mary Smith, and Dave Carroll.
And Sarah, I can be your, or I can give you slide control if you would prefer that.
I don't think we're all kind of tag teaming, so I think it's fine. And Mary's starting.
Yep.
Okay.
Thanks, Terry. Good afternoon, everyone. As Francis said, I'm Mary Smith. I'm the manager at the ADRC, and I'm really excited to share some information today about our Healthy Aging Action Team. And I can't say enough great things about Sarah Boots and Dave Carroll being part of our tri-chairs, as well as our phenomenal action team. And you can see the team members there listed on the right. If you can go to the next slide. So I want to begin with the why. Why are we talking about healthy aging? And you can see on this slide that by 2040, over 31% of Waukesha County's population is going to be 60 and above. And why did we choose 60 and above? The Federal Older Americans Act uses 60 plus as a senior. And so oftentimes you'll see 65 plus, but for our work on this Healthy Aging Action Team and for all of our data, it is 60 plus. You can see here that in 2010, we were approximately 80,000 people in Waukesha County over the age of 60. And 2025, we're looking at 128,000, almost 50,000 people more in just those 15 years. And as we progress to 2040, we'll be at 31%. Currently, about 42% of Waukesha County households have at least one member that is 60 or above. And as someone who's worked in the aging arena for over 25 years, I've been talking about our aging population, and I am so excited that it is finally becoming one of our community priorities. We're very fortunate here in Waukesha County. We are a resource-rich county, and we often think of ourselves as not a diverse county. However, I beg to differ. We may not be racially and ethnically diverse. However, related to income, housing situation, and level of disabilities in our population, we are a very diverse county. Currently, about 27% of our seniors identify as having a disability, and 37% of our individuals live alone who are over the age of 60. And we continue to see an increase in the number of individuals in our community with dementia. So why did we choose falls and social isolation as our end results? As our action team came together over the year 2023, we really looked at our data. There was so much tremendous data out there. Excuse me. So much data out there, and we really did a lot of brainstorming and dot matrix scoring. Our action team had some aha moments in regards to the ranking of the high number of falls and deaths to our seniors. And it was also during this time that the Surgeon General declared social isolation and loneliness as an epidemic in our country. Waukesha County has high falls-related hospitalization rates, and our mortality rate from falls is higher than the state of Wisconsin average. The interesting thing is that 56% of falls for seniors occurs in their home, oftentimes in their bedroom or their bathroom. So we often think of falls happening outside, our icy winters, but it really is the falls related to people in their homes. As far as the Surgeon General report, which was issued in April of 2023, the physical consequences of social isolation are just so great. We see an increase of about 30% an increase in heart disease, stroke, and over a 50% increase in dementia of people who are living alone and isolated. So it was really these statistics and this data that really led our team to select falls and social isolation as our two end results for this action team. And I'm going to pass it on to Sarah to talk a little bit about falls.
Great. Thanks, Mary. So as we, as an action team, looked at what kind of an end result we wanted to see related to falls, we came up with the end result that all, people 60 and older in Waukesha County will be safe from falls. The way that we plan to monitor this, Mary mentioned the high rate of hospital emergency department visits. Not only ED visits, but we have a high rate of hospital admissions and Waukesha County 911 calls. By focusing efforts on keeping those 60 and over safe from falls, we will be expecting to see those data points come down over the coming years, and we will be monitoring that data. So how are we actually planning to do this? Is our specific strategies. So as we look at how we kind of have these laid out, the first strategy listed is we are planning to do an environmental scan. We know that we have many great programs and resources within Waukesha County. We plan to formally gather and identify them. We're particularly interested in learning about the various evidence-based programs that focus on fall prevention. We know they're out there, we know they exist. But we want to do that so that we can really determine where the gaps exist and how we can find ways to expand those programs and also help to identify some of those barriers and gaps. Programs like this would include things like Stepping On and Ballroom Basics. Once we've completed this environmental scan, we plan to centralize resources and really find a way to communicate and share them with our community members in point number 2. Strategy 3, we learned early on in our work with our Healthy Aging Action Team that there was a lot of energy around the creation of a new Waukesha County Falls Prevention Coalition. So rather than duplicate work, we plan to collaborate with this coalition, come alongside them, support them, and really work with them. And then finally, all of this work is great, but we know that it's useless unless our community members know about it. So we plan to create an educational campaign where we're going to focus on fall prevention and share all of these many community resources. And with that, I will turn it over to Dave to talk about our second end result.
Great. Thanks, Sarah and Mary. I just want to underscore something that Mary said. The Surgeon General has declared that social isolation and loneliness is the epidemic of our time. In addition, the Harvard study of adult development, which has been ongoing for the last 85 years and it's continuing, has found that good relationships lead to health and happiness more than anything else. So if we're going to lean into anything, invest in anything in our life, it is really into the relationships that we have. And so our second end result is that all people in Waukesha County will have social connections. This is critically important for older adults, but it applies to the entire lifespan. And we want older adults, as you'll see in our strategies, to have intergenerational opportunities within families and within the communities. Our indicators for this are to decrease the number of adults reporting feelings of loneliness and isolation, and to decrease the percentage of those reporting poor mental health days. Poor mental health days are a measure that is based in the Community Health Survey of county data. And right now, Waukesha County is doing the best of all counties in the state of Wisconsin. We know that roughly on average, adults reported 3.8 poor mental health days in the past month, but we really want to focus on decreasing that number even more. And our strategies for doing that, if you can go to the next slide, please, are to, also conduct an environmental scan of available programs and to centralize those resources. We expect there to be synergy between what we're doing in terms of fall prevention and social isolation and social connection, that often those things may work in tandem, and to really kind of understand all of those opportunities. And as Sarah said, to create awareness of what's available in our program. We know specifically that there are some intergenerational programs already. We want to not only inventory them, but to create models for fostering new opportunities through community partnership around intergenerational skill sharing. So it's giving in both directions. And finally, to work on creating a volunteer engagement campaign, because we know one thing that really contributes to our connection with other people is to have that sense that we're doing something to help others. And so to promote volunteerism across the county will also help in terms of our social connections. So Francis and Terry.
Yep, we can take it from here.
All right,
Healthy
thank you.
Aging team, we are so grateful. I know a couple of people have dropped some items in the chat. As someone who's in that category, I'm grateful that you're working on this. Francis, do you anything else there, or we'll just maybe move right into our next team?
Yep, let's do that. So next I would like to introduce our mental health action team. I believe Amanda Wiss, Daniel Shine are here today. So I'll turn it over to them.
I'm actually going to kick us off. So Amanda
Huber.
Two Amandas on this group. So we are the quad chairs for the mental health action team. My name is Amanda Huber. I am a clinical supervisor at Waukesha County Health and Human Services. If you want to flip to the next slide.
Oh, sorry. Yep.
That's okay. Amanda Wist is the manager of community benefit and impact at Freighter Health. Daniel Shine is the Community Outreach and Education Manager at NAMI, Southeast Wisconsin. And Dhruvi Shah, who is not with us today, is an epidemiologist here at Waukesha County Health and Human Services. Next slide. Imagine, I am a 10-year-old sitting at a desk in a classroom, and my entire body is shaking. I can't take a deep breath because it feels like there are a million bricks on my chest. Tears are swelling in my eyes, and I look to my teacher for some help. She looks back at me with wide and fearful eyes, and I can tell she does not know what to do to help me. So she calls the principal. I am a distraction in the classroom. And she's not wrong, but I am also a student having an anxiety attack. And this happens day after day after day. I have an anxiety attack. The teacher has no idea what to do to help. And then I wind up in the principal's office. I am alone. No one understands me and no one can help me. So then I go home. But my parents only see that I am not getting homework done and I am not doing chores around the house. And I try to ask for help, but I don't have the words and I don't know what is wrong with me. So I sit alone in my bedroom and I feel numb. And I decide to self-harm because it's the only thing that makes me feel anything. And my thoughts are racing and I just need this pain to stop. In 2021, suicide was the second leading cause of death for youth aged 10 to 14 in the United States and in Wisconsin. 1 in 5 adolescents had a major depressive episode. And in Wisconsin, the ratio is 440 youth to 1 mental health professional.
So you can go to the next slide, Terry. The assessment of data, engagement with partners, and collective discussions have helped our action team understand priority populations and important health indicators. Based on the data, there have been significant increases in certain mental health disorders in youth, including depression, anxiety, and suicidal ideation. Youth face unique health disparities, and prioritizing their health will be essential for improving the health of Waukesha County overall. Therefore, our action team agreed that the end result should be that all adolescents between the ages of 12 to 18 in Waukesha County will have improved access to mental health services and increased knowledge of mental health resources. Next slide. We identified 3 indicators to, oh, I'm sorry,
Oops,
Terry.
Sorry.
My fault. We identified 3 indicators to measure our success. The first measure, we want to decrease the percent of self-reported depression in Waukesha County, as this measure directly assesses the mental health status of adolescents in the community and indicates an improvement in mental well-being. Secondly, increasing the number of mental or behavioral health visits indicates an increase in help-seeking behavior among adolescents. This suggests that adolescents and or their caregivers are more willing to seek professional help for their mental health concerns, have appropriate knowledge to navigate the system, and barriers have been reduced to access care. And then lastly, focusing on the percentage of visits specifically related to anxiety and depression provides insight into the prevalence and severity of these conditions among adolescents in our county. An increase in percentage of visits for anxiety and depression may seem counterintuitive since the goal is to really improve mental health. However, it could indicate that more individuals are correctly identifying and seeking treatments for these conditions, which is a positive outcome. All of these indicators highlight the importance of targeting these specific mental health issues in interventions and allocating resources accordingly. At this time, I'm going to hand it over to Daniel Shine to review the strategies that we will address our end result.
Thank you, Amanda and Amanda. As part of the Community Health Improvement Project team, our focus is on enhancing youth mental health across Waukesha County. We're dedicated to implementing targeted initiatives that address the pressing mental health needs of our community's younger members. So the question you might be asking, right, is how are we going to get this done? So on this slide that you have here, here are our 4 strategies that we plan to implement. Our first initiative is to expand Ending the Silence. Ending the Silence is an evidence-based program hosted by NAMI Southeast Wisconsin. This initiative brings speakers with lived experience related to mental health into schools to share stories, foster a deeper understanding of empathy, and further understanding mental health challenges that our youth face. Our second is we're also launching a mental health awareness initiative. These events are set aside to focus on mental health awareness, education, and support activities within the schools and communities, creating a culture that openly discusses and supports mental health well-being. The number 3 on our list, to bring enhanced coordination of services, which we all know can be one of the most complicated pieces. We're introducing a community mental health worker. This role is pivotal to connecting children and parents facing mental health crises when the resources and support they need are needed the most. And then finally, number 4, we're committed to enhancing our data collection and utilization. Oftentimes, this can be the most complicated too for a larger team. By understanding the specific needs and measures the impact of our programs, we can refine our approaches and ensure that we're making a meaningful difference in the lives of our youth. So finally, these initiatives represent our commitment to not only just addressing the mental health needs and challenges, but also creating an environment where every individual, regardless of age, can thrive. While we've made significant strides so far in our groups, we recognize that our work continues to be ongoing. The collective impact of our efforts, combined with the roles that everyone plays within our group, is supporting mental health in our community. With these initiatives as our foundation, we're setting the stage for a comprehensive strategy to enhance youth mental health right now in our community. Thank you. Thank you guys for letting us share too. We really appreciate it.
Thank you, Daniel and Amanda. Really powerful. And I really love that story that you told, Amanda. Last but certainly not least, I would like to introduce our substance use action team, and I'll turn it over to Haley.
Good afternoon. My name is Haley Nanonen, and I am one of the co-chairs of the Substance Use Action Team for Waukesha County. You can see the other co-chairs on the left side of the slide in the white. We've been working with an esteemed group of folks really for the better part of a year that are listed there on the right side of your screen. We have been diving into the data, going through root cause analysis, also that we can build and put forth a plan that we feel can help move the needle in the substance use arena within the county in the next 3 years. We recognize that substance use has a very large scope, and there are a lot of organizations doing very impactful work in this space. And so we were very intentional about making sure that we are aligning with the work that is going on, that we're not duplicating efforts, but that we are focusing in on an area where, again, we do feel like we can help move that needle over the next few years. So I will talk to you about our first end result on the next slide. So our first end result, people who use or are in recovery for opioid use in Waukesha County have access to life-saving interventions. This end result is driven by 2 data indicators that I will review for you briefly. So the first is to decrease the number of opioid-related deaths for Waukesha County residents 18 to 44 years old. So why 18 to 44 years? That's because the data tells us that that is the age range that is most at risk for overdose deaths related to opioid use. So we want to make sure that we are targeting our efforts to that particular age group. So we want to make sure we see this trend line go down. We want to decrease deaths. The second indicator, increase the number of people receiving certified peer specialist substance use support in Waukesha County. I'm going to talk a little bit about what certified peer specialist services are when we get to the next slide, but just know for now that we want this trend line to actually go up. So we want to increase access and increase the number of people who are being able to utilize these services. So you can go on to the next slide, please. So here are our strategies that help support those data indicators and that end result. And this is going to kind of get to our why did we choose this and why are we in this space. So the first one is all about harm reduction. So we want to be intentional about coordinating and working with the Heroin Task Force, so with you all, to educate and promote harm reduction strategies. So what are those? Those are really the evidence-based actions that we can take to put life-saving interventions into the hands of people who use drugs with an intention to create positive change. So an example of that could be Narcan. Think about where Narcan was even 5 years ago to where it is today in terms of access and distribution. So this subgroup is going to be looking at what are those emerging harm reduction strategies along with the Heroin Task Force, and what can we do to help increase the prevalence of them in the county and get them into the hands of people with substance use disorder. Our second strategy really centers around stigma reduction, and we would like to work with that team of the Heroin Task Force to embed training in 2 specific sectors, law enforcement and healthcare. We know there's been a lot of training in these areas already. However, we feel it's important to help continue to support that work, because we know first responders and frontline workers are the people who can help those who are going through an overdose or going through a substance use disorder challenge and help set them up for recovery. And so this could be anything like working with folks on using people first language. And why would we want to do that? That's really because we want to make sure that those who are responding, frontline workers, first responders, see the whole holistic person, not just the acute stage that they're experiencing at that moment. And using people first language is really one of the starts to being able to do that. It could also be working around unconscious bias. We all have it. We need to recognize it. We need to talk about it. And once we can do those 2 things, we can start to shift the conversation and shift those biases when we feel them start to come up with us. And all of that is really to help make sure that those patients that they're treating have the best shot at recovery. And that is really our why. And you're going to see it flow through strategy 3 and 4 as well. We want to help make sure that people who have substance use disorder or people who are in treatment have the best opportunity for recovery and to elongate that recovery. So that's going to kind of move us into our 3rd and 4th strategies. It's really one strategy with 2 arms, and I'll talk about them both. The first is certified peer specialist. So educate people in substance use treatment about the benefit of this service. So certified peer specialists are an evidence-based practice that serves as a complement to traditional clinical treatment. So these are folks with lived experience who are in recovery and can walk alongside that person in treatment as they are on their journey. They can help with things like goal setting, linkages to other social needs. So whether that be housing assistance, food security, that sort of thing. They can also help with safety planning. So again, making sure that we are helping people be on the best path to recovery with somebody who can empathize and know exactly how they're feeling in that moment. So we feel very strongly about this particular role. So we want to increase the amount of people utilizing this evidence-based service. And if we're going to do that, and if we're going to increase access, we also have to build the capacity for that volume. So we want to talk with people about the benefits of serving in a certified peer specialist role. So we want to attract, engage, and educate people longer term in their recovery about the benefits of this career path and how fulfilling it can be. And then ultimately, we want to be able to employ them, and help build that capacity. So as we talk about the service and as more people have access to the service, we have the people waiting in the wings who are able to serve in that space and help people with substance use disorder. So that is our first end result, and I am going to turn it over to Jamie Bauer to talk a little bit about our second end result, which is in the housing space as well.
Thank you. Housing is a complex topic with a storied history. So today we will focus on highlighting a common indicator that researchers use for measuring housing affordability, known as rent burden. Rent burden is defined as a household spending more than 30% of their income on rent. A report released in July of 2023 indicated that 43.4% of Waukesha County renting households were considered rent burdened. The report further indicates that Waukesha County's median rent is second highest in the state, only behind Dane County. Next slide. Okay, imagine you are employed in Waukesha County, but you can't afford to live here, so you also have additional costs related to commuting. Your car unexpectedly broke down last week, and the shop is estimating a $1,500 repair bill. There's not a bus line that can get you to your employer in Waukesha County, and your support system is limited in their ability to consistently get you to your job. All of this would be extremely overwhelming and difficult to juggle. Now imagine you have a diagnosed medical condition that feeds off stress, a substance use disorder. So now on top of everything else, you must also be on a recovery journey, whatever that may look like for that person. Life throws us enough curveballs, and it can be hard to juggle everything, even when you're healthy. When living with a chronic medical condition, all the other issues in life can become exacerbated. These are not uncommon stories of what people in our community face daily, and I can't help but ask why. Why is it that safe and affordable housing is not accessible to everyone in our community? To get to the bottom of this question, we established 2 data indicators for our end result. The end result we chose is that Waukesha County residents who use opioids will have access to stable housing. And our first indicator is the percent of people in substance use treatment who have a stable place to live, and we want this trend line to go up. The second is the percent of people who use substances and are experiencing homelessness. We want this to go down. Next slide. So there are 3 strategies that we have that we hope to impact those indicators. The first is we need to identify what assets related to housing exist in this community, and we need to expand upon them. From this asset mapping, we'll have a comprehensive list of accessible and affordable housing options in Waukesha County. Second, we want to engage a diverse cross-sector of partners through key informant interviews to see what meaningful investments and changes this community is willing to take. We're hoping to work alongside developers, city planners, aldermen to the Housing Action Coalition, Hebron Housing, United Way, and NAMI. We want to learn from our partners and show up to support their work to end chronic homelessness for everyone through an advocacy plan. Our third strategy is we plan to research housing navigator models with proven efficacy in reducing and preventing homelessness. A housing navigator could provide linkages to housing, help with housing assistance applications, and offer referrals to important resources. Housing is a social determinant of health and a protective factor that can prevent the exacerbation of additional life stressors. Everyone deserves access to safe, stable, and affordable housing, which will ultimately lead to improved health outcomes and reduce costs for the entirety of our community. Thank you.
Thanks, Jamie. I'm going to pause for just a quick second. Jamie is also going to be talking about the ARPA grant funding in just a minute. She's playing quite a few roles, and I also want to introduce her as my partner in managing the Heroin Task Force. So if you have any questions about the Heroin Task Force or want to get engaged in an action team, Jamie and I are working closely together. And I think Rachel, I think you're going to drop her email in the chat, and if not, I will be happy to do that. The second thing before I turn to Jamie for the to talk about the ARPA grant funding, many of you on the call will be coming to the CHIP launch event on Thursday. Unfortunately, we had a room restriction, so we couldn't just open it up to just anybody, and that is why you all are getting the preview, because we felt it was really important for you to hear it from these folks today. But those of you who were invited to the CHIP launch, it accidentally came off your calendar. There was a glitch in Outlook. It has gone back on your calendar. It has not been canceled. We are looking forward to seeing you at 8 a.m. for networking and 8:30 for the program start on Thursday morning. So if you have any questions, you can reach out to, again, any of us, Jamie, Terry, Francis, any of us. So I'll pause there. And Jamie, I'm gonna, Francis, I didn't mean to jump in. Anything else you would like to say to close this section before we turn to Jamie and ARPA funding?
Yeah, I appreciate all the teams. That's the first time I heard them do that, and it was amazing. And it's a lot shorter than we have on Thursday. So if anyone was like, whoa, that was really fast. We wanted to do this for you, but we didn't have a lot of time. So yeah, I will pass it to Jamie and she can talk about the CHIP ARPA funding, which is a really cool and unique opportunity.
Yeah, and I too want to share my gratitude. You guys, it was amazing. Yep, brought me to tears, just saying. So, all right, Jamie, we're going to turn it right to you.
Okay, great. Thank you. Again, hi. So the ARPA grant opportunity. So this helps Waukesha County uphold our CHIP values. We're able to be more equitable, inclusive, and innovative when we have funding to further our work and mission. You can go ahead and go to the next slide. Agencies that normally would have no budget for community improvement now can have up to $300,000. That's right. Public health has up to $300,000 to award to community partners to propel our CHIP work forward. With ARPA funds, there are very few restrictions on what it can be used for. This gives agencies the opportunity to be creative and even propose new services that would need startup costs to get going. Applications will be scored by a diverse panel to award funding for each strategic health priority. This means there will be at least one award made for mental health, substance use, and healthy aging. Next slide, please. Any community partner is eligible to apply for funding. As this is a county initiative, applicants must serve Waukesha County residents. The strategies that were presented today by the action teams are the blueprint for the direction we want our CHIP process to go in. Applicants that align with the action teams and their strategies will receive higher scores during the grant review process. Next slide. March 21st, we will have a virtual information session for interested agencies to attend. Questions are encouraged. More information about the grant will be provided at that time. On April 5th, we're having a virtual technical assistance session, so agencies have an opportunity to ask questions and receive assistance with completing the application. Grant applications are due April 24th at 4:30 p.m. Applications will be scored in May, and awarded agencies will begin the county's contracting process in June. Next slide. Oh, maybe not. The scoring panel will be awarded funding to agencies that are responsive and that score highest. The contract will be an 18-month contract. And when the awarded agencies have been selected, all agencies that submitted an application will receive a written response. Agencies that are awarded funding are expected to provide quarterly data reports, invoices, and supplemental documentation as requested. The next steps include visiting our website, attending the virtual information and technical assistance sessions, and apply. Feel free to email chiparpa@waukeshacounty.gov or me with any questions. Thank you.
All right, so that CHIP ARPA, we put Jamie's in there. I didn't know about CHIP ARPA. I'm sorry about that. If you want to pop that into the chat too, Jamie, that would be awesome. I'm going to just pause for a second. We have really thrown a lot of information at you. Questions regarding the ARPA funding? This is really important. Go ahead, Larry.
Okay, can I ask my question about the whole thing, not the ARPA funding?
You bet.
So this tomorrow will be at least the third or the fourth CHIP launch that I've been at. And first of all, I want to say this preview looks like it blows the previous CHIPs out of the water in terms of the goals and the plans. But my biggest complaint about the last two CHIPs, and this goes back to when I was mayor as county supervisor, the thing I remember the most is saying, what the heck is happening with the CHIP? How do I find out what's going on? So my question is there any thought of doing either a CHIP newsletter or a way to sign up to get CHIP emails when some of this information gets updated? Because I think the people who are directly involved in the CHIP obviously know what's going on and will be actively working on it. But I think there's other people like myself as an elected official. I really would like to keep up with it and know where we are and not wait 2 or 3 years to hear, look at what we accomplished. So I don't know if that's a fair question, but that's what's on my mind.
Yeah, thanks for that, Larry. I will jump in, and then if someone else has something, they can also jump in too. So I think that's a great idea and definitely something I'll share with Lisa Kwiat, our communications person. We heard the community after the last chip, which was, you say you're doing good work, but I don't know what that work is. And so we're trying really hard to make our work more known. I put oh no, it got blocked. I'll fix that too.
It did. I'll take a
Okay.
look at it.
I will get a better link.
Yeah.
So we are working to make this process more visible and more transparent. So the link I will fix when I'm done talking is our Clear Impact link, which is our scorecard. It's where our data is. It's where our action plans are. It's where you will find out what we are doing. Our website, www.waukeshacounty.gov/CHIP, also will be updated fairly often, as well as all of our social media sites. And then in terms of a newsletter, we can definitely see if that's a resource that people would read and use. So I love that idea, and we'll definitely look into it.
Yeah, and again, like Francis said, the social media sites will be updated as well. Francis, I'm just going to put the public hosted page in the chat.
Yeah, I posted my version of it. Sorry, everyone.
Yeah, I'll pop it into the chat right now. There we go. All right. Try this one, you guys. But Larry, that is the fact that we have a Lisa Kwiat, a Francis, a Jamie, and all the other resources that we didn't have before is making a tremendous difference. So this is really, really good news. And I'm so grateful for our teams. They have worked so hard, and you guys, I'm blown away, just blown away. You guys have done a beautiful job. So we are ending. We have 2 minutes to close down our meeting. I guess I would like to, before I turn it to Mary to officially close, are there any community partners that would like to share any things that are coming up in your world? You can pop them in the chat, or you can just unmute and give us a little bit of information before we completely shut down. Okay. I'm going to move us to Mary then, and I'll go ahead and share the last slide, and you can go ahead and close us, take us home.
Well, I'm like totally overwhelmed. I don't know if everybody else is, but there's a lot of information in this presentation. So I just want to give a shout out to everybody for their work and their time and the energy that you put towards this. I really do appreciate it. Like the notes say, there's a slide deck, and the recording for this will be out next week. Hopefully you'll be able to find it on our website. I'm still trying to figure out why it's not pulling up properly, but that should get fixed soon. So watch our website, WC HTF, and try the .com, because I think that one's working.
Well, and if you just type in Waukesha County Heroin Task Force, or HTF, it might take you to the county one, and we've got a link right to ours too. So that it should be one of the top ones.
And I'll make sure that if you would like to get involved with us and one of our action teams, reach out to Jamie Bauer. She'll get you on the mailing lists and the email list so that you can get more actively involved. And then watch for the next partner meeting. The next one is going to be in person, June 11th. So excited to see everybody. It'll be from 2 to, we'll have networking from 2 to 2:30, and then the meeting time will be from 2:30 to 4:30. So looking forward to seeing you guys in person. Thanks for coming today.
Mary, thank you. And I am going to hang out. There's been a lot going on in the chat there. For those of you who are trying to access some of the CHIP resources, we're refining the last few things before the CHIP launch on Thursday. So we appreciate your patience. I am just thrilled that so many of you were able to stay and listen to that work. This was a lot going on in this meeting, but this was great. So I'll hang out. Francis, I don't know if you have a minute to hang out if anybody has questions. I can hang out Francis might not have time to
Yes,
hang
I can. I'm gonna hang
Okay.
out too.
All right, and I'm going to go ahead and stop our recording.